Indeed, it's been a long road to UHC. And I'm more than convinced that this is the time that UHC must work in this country. When the government came to place in 2022, the first thing and the first assignment that was given to the Ministry of Health was to formulate laws. And we enacted 4 laws. You know, a law is a base. Because you don't want to build something that is going to crumble tomorrow, where nobody has no reference. And the first law was the Primary Healthcare Act of 2023 that incorporates, these people are found in the screen, the community health promoters. The second one was Digital Health Act of 2023. Only yesterday, we have realized that even when a doctor goes to treat someone, you will need to enter your number. Unlike before, when you would never find information of who treated you last year, or even corrective issues that can be taken up by another doctor. Equally, putting away the books, the exercise books, the quota exercise books that we grew knowing that the doctor has written a prescription, but when you're referred to another facility, you have no reference because probably that exercise book has already been rained on or something, or destroyed. And the third act that we established was the Facility Improvement Financing Act of 2023. Ladies and gentlemen, let me just tell you something, that it is not that there's no money for health or there has been no money for health, but many a times is when we used to see budgets reallocated, money that is meant for health, for commodities, for infrastructure, for equipment, reallocated for other functions. And we needed a law to ring fence these amounts so that they can do the work that is intended for. And finally, ladies and gentlemen, is the Social Health Insurance Financing Act of 2023. If I tell you that only 20% of our population would access health facilities and services through our NHIF, the National Health Insurance Finance Fund, and we only had one fund for that matter that catered for that 20%. And it was 20% because most of them were employed, like you and me. The informal sector could not access services that were offered at any health facility. Hence, there was need to come up with an insurance or an authority that will oversee that every other Kenyan accesses services available, affordable, accessible, and acceptable quality healthcare. That is why we came up with the laws, that there is equity even in the access to these services. And just moving on, I know some of the questions that many people will be asking. How do you tap in then the social sector, the informal sector, that is 80% of our population? Really, we have seen that in the Social Health Authority, through the Social Health Insurance Fund, we have subsidies for the poor and the vulnerable. Hence, we are able to also reach out to those people who cannot be able to pay even a penny, and the government is going to pay for them. And let me just break it down for you. The Social Health Authority has 3 funds, as opposed to the one fund that was the NHIF. We have the Social Health, we have the Primary Health Fund, which is taking care of the primary level facilities, so that if you go to those facilities, that is the level 2, level 3, which is dispensary and health center, you do not pay a coin. We have the Social Health Insurance Fund, our pooled funding, where me and you are paying. And we have the Emergency, Chronic, and Critical Illness Fund at the same time. But we are saying if you cannot afford to pay, then the government should pay for you.